All right, welcome back to the Elias Macko Show. Third hour of the show, we'll be with you until noon. We begin by talking about Canada's new dental care plan. Nearly 9,000 oral health care providers have signed up to provide services under the Canadian Dental Care Plan. The number apparently is growing. Now, there are 30,000 plus oral health providers that could sign up. The plan will eventually provide dental care coverage for 1 in 4 low and middle income Canadian residents who do not have coverage. And since coming into effect, the plan has already seen 46,000 claims being filed so far for things like broken teeth and infected gums. Let's now go to Dr. Doug Hamilton, dentist at Westmount Dental Care, and I should point out, also my dentist. Dr. Hamilton, welcome back to the program.
Hi, Elias. How are you?
I'm doing well. As we start off these interviews where you come on this show, can you confirm to the audience I have great teeth?
Confirmed.
Okay. I was looking for something more robust, but I'll take it. Okay, Dr. Hamilton, let's talk about the actual program here, because I think there were a lot of questions when this was announced, and I know Quebec hopping mad that it's superseding a provincial jurisdiction, that kind of thing. Why don't you tell us from your perspective how you see the Canadian Dental Care Plan?
Well, I think that most dentists would tell you they are not happy with it as it is organized right now. I think you would have a universal affirmation that we want to take care of people that need the care, and there's about 9 million Canadians that don't have any access to care, and it's a problem. And I'll tell you, I worked in the hospital when I just graduated, and we treated a lot of these people, and it's really desperate care for a good number of people. So let's just say that there's a really big need, a very serious need for care. So this is a proposed answer to this problem, and the problem's probably going to get worse as the population ages. So I think it's a really good initiative, but it has to be organized properly. And the problem is the government, probably for political reasons, didn't want to really talk about it, didn't want the cat to get out of the bag. And so they organized a plan and they didn't tell anybody. Unfortunately, they never told the dentists. So we weren't really consulted at all about the structure of the plan. They just presented it. And they had signed an agreement with one insurance company before it was announced. And there's a number of problems administratively that make it very difficult for dental offices to engage the plan. So from that point of view, it's kind of not good. We had a study club meeting. We have a group of about 15 doctors, and nobody wanted to get involved with the plan as it was structured. So there are definitely some problems, but the need that is out there is really serious. Mm-hmm. And so I think it's about time we did something, and I'm happy they did it.
And I know we've discussed in the past how you've been hesitant at times to get onto these government plans right here in Quebec, the ones that cover, let's say, youth and that. And you've brought up the problems here that sometimes happen when the government wants to administer a plan like this. Why this time around? Why have you so quickly decided to hop on this, despite maybe your reservations?
Well, look, it's an act of good faith, and I think that all of us want to sign into it. And we just want to believe that the government's going to do the right thing. But, for example, with the Quebec plan, as we had it, they started the plan in 1960. They didn't give us a raise until we went on strike in 2010. That's 50 years trying to work with the same fees. Imagine that. Mm-hmm. And so we were all working at a loss, like providing care substantially below our costs. And people that had to do a lot of children's care were actually, would go bankrupt. So it was a serious problem. The Quebec government did not want to fund the plan. They actually wanted to get out of dental care. And they were trying to get us to drop out of it so they didn't have to deal with it and blame us for it. That was a serious problem. We acted in a way to preserve the plan, to save the plan, and the plan was eventually more fully funded. And we actually had to sue the government twice for them to pay what they agreed to in the contract. And then they decided to pay us over 3 years. So we were treated very badly by the government. So, our reluctance, you can see with our history of working with the government, not really dealing very well with dental offices. I think it's really not understood. The cost of delivering services is very high. Highly trained people, expensive materials and equipment, and running a dental office is really hard to do. And margins are not. Everybody thinks that doctors are rich. We're not rich. And so we have to have a fee structure and an administration structure that can make it so we don't lose money while we're operating. Mm-hmm. And that's a big concern for the doctors. Can we do it? Can the government fund it and continue to fund it at an appropriate level?
With Dr. Doug Hamilton, dentist at Westmount Dental Care. Dr. Hamilton, with that in mind, for this federal plan, is the Canadian government paying a reasonable amount, covering a reasonable amount for procedures?
I think the fees generally are a little bit on the low side. And we have to remember that it's just one fee, right, that they're putting into this plan. But different offices have different expenses. So an urban office will have much higher rents, will have much higher salaries to pay than, say, a rural office, which generally they pay lower pay rates for the workers, and rents can be a third or half of what you might pay in an urban center. So depending on where the practice is, there's huge swings in the operational costs, and the fee structures have to reflect that. So, but if you have a plan that has one fee structure, then there could be a problem depending on where you are. Mm-hmm. The other thing we have to consider is the experience and the skill level of the office people. If we have very long-term employees that are highly skilled and highly trained, they're going to cost a lot more than an office that has basically everybody that's relatively young and not experienced and not trained. They haven't been on the job very long, and their salaries are much lower, so the costs of operation are lower. Mm-hmm. So depending on the office, the operational costs can vary a lot. And so we can't have a plan that is paying a fixed amount of money and have it work for every office. So we have to have offices able to charge different rates for the care they give. And if that's the case, then the way that the exchange happens, the way that we get funded, has to be able to be flexible to allow for that. And right now, there are some issues that most doctors have with the way that we're sort of forced to take payment from the insurance companies, and it becomes an administrative quite a bit of a burden. Mm-hmm. And if you have an office with a lot of extra patients that are now on this plan, we might even have to hire extra staff just to do the administration of the insurance, which is a further burden, making it very difficult. So most doctors are very afraid of, one, will the fee structure support us adequately so we don't lose money? And two, does that mean we have to hire new staff? And if we don't have room for them, where do they go? I mean, it becomes an administrative nightmare, mm-hmm. actually, in terms of management. So because they haven't consulted with doctors, we haven't been able to have a structure to the plan that actually works for us, that they want us to work in a way that we generally don't work. And right now they are consulting. A friend of mine, Joel Anton, he's the president of the Canadian Dental Association, is trying to work this out with the federal government and have them sort of make the plan, maybe some alterations. And it's not a big deal. We just have to negotiate some alterations in plan structure, and then it could actually work very well for doctors. That's being worked on right now.
And let me just ask you here, because it seems like the sheer number, 46,000 claims being filed so far already, that seems quite good. I just want to know, have you been offering, how has it worked for you? Like, what are you seeing people come in using the Canada Dental plan for?
Well, we have registered and we're ready to go, and we're just starting right now. Like, our goal was to be able to handle it. We have to make, like I say, administrative adjustments because the way they want us to engage with the insurance companies is not the way we engage, not the way we normally operate. So we have to actually plan to plan and provide people and personnel and whatever to get it all in place before we can get going with it. But we will be going with it soon. I think probably by the end of the month, probably by June 1st, we'll be operating with it. So people are doing work, but I will tell you there's an electronic data interchange that can work. Some doctors have it, some doctors don't. Most do, but the ones that don't have to do paper transfers. And I had one report from one doctor that said they don't actually have a mechanism to pay the offices yet, the dental offices yet, if they're not using electronic data transfer, and it might take until October before they get paid.
Ooh.
So when we talk about administrative issues, that's kind of a big issue.
Yeah.
We can't work on people if we're not going to get paid. So it's just business and cash flow, right? You have to have money coming in and going at an appropriate pace so we don't run out of money in the bank to pay salaries, et cetera. So let's just say it's going to be an administrative nightmare for every office until we have it settled in and figure it out. The Canadian Dental Association is trying to negotiate changes in the structure of the system so that it is better suited to dental offices. And we have to be very careful that the government fees paid can keep up with actually the costs of delivery of service. Now, another thing to be very clear on is the public, and we are getting phone calls all the time. I'm ready for my free dental care. I'm ready for my free dental care. It's not going to be free dental care. It's going to be insurance-assisted dental care. And there will be what we call a co-pay. The government will pay part of it, and patients will have to pay part of the cost. That's any normal dental insurance works. So that is not clear. It's not understood. And I think we're going to have some issues because we do have some people that have absolutely $0. Mm-hmm. They don't have any money. Even if, there's a lot of government support, they can't afford maybe any extra money. So we're going to have to figure this out. This is, like I say, they haven't really talked to the doctors that deliver the service, and so they don't understand all the problems that will arise.
And what an undertaking, Dr. Hamilton, just on a short time frame. We've got to leave it there. I want to thank you so much for coming on this morning.
You're welcome, Elias.
Okay, take care. That's Dr. Doug Hamilton, a dentist at Westmount Dental Care.